I believe that difficult horses may show one behavioural sign, such as rearing, but most so-called naughty horses show many behavioural signs consistent with underlying pain, and education of everybody involved in the equine industry is required. Bear in mind that the picture may be misleading unless you see the full repertoire of movements. This is an upper-level dressage horse working in medium trot, and the horse is moving with athleticism and looks happy. When this horse is asked to do a canter pirouette, here a canter pirouette to the left, we see a different picture. An intense stare, tail swishing, the ears back, and the horse ultimately grinding to a halt. Horses are trying to communicate with us. We just have to learn how to listen to them. We need to know what normal looks like. I'm the first to say that some horses can live with problems and perform willingly and adequately without deterioration in the underlying problems. And I'm not saying that these horses should not be ridden. However, unwillingness to go, lack of responsiveness to the rider's cues, and a display of 8 or more of the behaviours of the ridden horse pain ethogram, I believe needs investigation. We need to justify our social license to operate. I believe we have moral and ethical responsibilities to the horse, and we have to recognise that by identifying the underlying problems, we have the potential to enhance performance and improve the demeanour and welfare of horses, which has to be our aim. I strongly believe that if we identify the underlying problems, that with appropriate treatment and management, we can achieve improvements in equine performance, their rideability, their trainability, the rider's position and their comfort, their safety, and their confidence. If we compare these two images, on the left, the horse is showing a bilateral forelimb lameness manifest by a shortness in the forelimb step length. On the right, we see the same horse after diagnostic anesthesia, and we can clearly see an increase in the forelimb step length. Look also at the rider's position. In the left image, the rider's upper body is inclined forwards, whereas in the right image, the rider has a much more upright posture, a better and more effective posture. She's going to be better able to influence the horse. Look also at the alteration of rein tension asymmetry. Before diagnostic anesthesia, the bit was pulled through to the left-hand side, and the rider had increased force being generated through the rein to her hand on the left side. After diagnostic anesthesia, the bit position is much more symmetrical in the horse's mouth, and the rider reported a much more even rein tension. Let's now consider briefly the influence of ridden horse pain ethogram scores and its relationship with performance. In this first study, the ridden horse pain ethogram was applied to horses competing at 5-star 3-day events during the warm-up phase for the dressage.